In der Regel erfolgt nach der Erstsymptomatik.
As already mentioned, brain imaging is usually done after the initial symptoms. If the disease is then suspected, we are contacted as a specialist center. As a first step, we usually have the imaging sent to us by post or via download code, and then look at what imaging is already available and whether we also agree to the suspicion of Moyamoya disease. Depending on the imaging available, we then plan an initial outpatient consultation or an inpatient stay in our clinic in order to have the necessary special imaging done to complete diagnostics.
Je nach Befund entscheidet sich dann,
depending on the findings, it is then decided whether the patient needs a conservative or surgical treatment. Patients who require a conservative treatment usually get a blood-thinning medication with aspirin, and a follow-up check is planned after 1 year using MRI. If you as a patient require surgical treatment, an operation appointment is scheduled via our case management. You come to our clinic on the day of inpatient admission, and few examinations are carried out. You will have a conversation with the nurses, anesthesiologist, and your neurosurgeon. On the day of surgery, you will usually be taken to the operating room in the morning. A bypass surgery itself takes around 90 to 120 minutes, and after the operation, you will spend a night in the recovery room and will be transferred to the normal ward the following day. You will then be mobilized relatively quickly with the support of the nursing staff and our physiotherapists, and will then be able to cope with everyday life on the ward independently. You will usually be discharged from the hospital after 3 to 5 days. If you need more than one operation, because more than 2 areas of the brain need to be supplied with additional blood, a second operation may be necessary after around 6 to 8 weeks. Generally, all patients will have an outpatient checkup with an MRI in our clinic 3 months after the last surgery. A total of 1 year after the operation, there will be another inpatient stay, during which the conventional angiography, that is, the imaging of the brain vessels, as well as special MRI examinations, will be repeated for control.